Order. Elliot Colburn to move the motion.
Thank you, Ms McDonough. It's a pleasure to serve under your chairmanship. Indeed, as my constituency neighbour, it's great to see you in the chair for the first time in Westminster Hall for me. Could I also extend my thanks to the Backbench Business Committee for granting time for such an important debate. And I would also like to thank the many Carshalton and Wallington residents who came forward to share their experiences with prostate cancer, either experiencing it themselves or supporting a loved one or a friend through this condition. I think it's fair to say that many people in this room and those watching will know a male relative or a friend in their life who has had prostate cancer. And I hope in this debate today will raise all the important awareness and the need to get yourself checked. Ms McDonough, there will be many striking statistics in this debate that will concern the members present. However, I'm keen to begin with a positive. Cancer survival rates in the United Kingdom have never been better, and survival rates have improved each year since 2010. Prostate cancer survival has tripled in the past 40 years, with 85% of men surviving 5 years or more. However, the COVID-19 pandemic threatens to derail this progress through a decrease in diagnostics, especially for men over the age of 50. There are over 47,000 new prostate cancer cases every single year, with a man dying every 45 minutes from this condition. And early diagnosis is the key to fighting this disease. Yet the pandemic has resulted in less men coming forward to their GP to get tested for prostate cancer, with the stay-at-home messaging deterring older men in particular who are most at risk from prostate cancer from coming forward. While the referral rate for prostate cancer has recovered to 80% of pre-pandemic levels, it is still lagging behind other forms of cancer, such as breast cancer, which is operating at 120% of pre-pandemic levels. Stark figures from Prostate Cancer UK have revealed that there have been 50,000 fewer referrals for suspected prostate cancer patients than the usual trends would predict, and the impact of this is incredibly worrying. 14,000 fewer men in the UK started treatment for prostate cancer between April 2020 and December 2021, compared to the equivalent months prior to the pandemic. That's 14,000 missing men that are living without knowledge that they have a condition, and 14,000 who have not yet started that all-important treatment plan. And the charity Prostate Cancer UK has warned that because of this, 3,500 men risked being diagnosed with late-stage prostate cancer as a result of late diagnosis. Ms McDonough, I cannot stress enough the importance of getting yourself checked if you have symptoms or you fall into the high-risk categories, which include men over the age of 50, Black African and Black Caribbean men, and men who have a father or brother who have had prostate cancer. Sadly, all the statistics and the anecdotes that many of us will have heard point to the fact that men are far less willing to get themselves checked. Now, whether this is out of embarrassment or fear, getting diagnosed early can make an enormous difference to survival rates, with 5-year survival rates over 95% for men who have been diagnosed with prostate cancer between stages 1 and 3. And there are fantastic NHS campaigns, such as the Help Us, Help You campaign, which has urged people with potential cancer symptoms to come forward with for those life-saving checks, and with the second stage of that campaign addressing the fear that often comes with booking that first appointment. But despite that fantastic work already being carried out, I hope that the Minister will be able to enlighten us on what more the Government is doing to destigmatise men coming forward to check their symptoms. Being checked for prostate cancer is important for all men, but particularly black men, both Black African and Black Caribbean men, because I was taken aback to learn that whilst 1 in 8 of all men will get the disease, 1 in 4 black men will be diagnosed with prostate cancer in their lifetime and are far more likely to be diagnosed with a more aggressive type. People from black ethnic minority groups are also 4% less likely to receive radical treatment than those from white ethnic groups. Through COVID-19, we have seen what we can achieve when we work together. I was proud to host a Carshalton and Wallington roundtable last year in collaboration with the NHS, the third sector and community groups to encourage ethnic minority communities to come forward and get the jab. And this was well attended and has demonstrated what we could achieve in prostate cancer diagnostics if the Government worked closely with the third sector and community groups to spread awareness. However, improving awareness must require a corresponding increase in imaging capacity. Imaging services such as MP MRI are critical to achieving earlier diagnostics and, as I stated earlier, key to survival. MP MRI screens can confirm or rule out prostate cancer in an accurate and timely manner, reducing the stressful wait for patients and their families. And from speaking to cancer charities, the significant levels of variation in access to MP MRI is concerning. And if we're to bring prostate cancer diagnoses back to pre-pandemic levels and indeed increase them, we must address this postcode lottery. MP MRI must, as a minimum, be expanded in line with growth rates prior to the pandemic if we're to get diagnostic levels back to where they need to be. And the 10-year cancer plan provides a golden opportunity to address this issue. Now, Ms McDonagh, I've mentioned several times that the negative impact the pandemic has had on the prostate cancer community. However, I am keen to highlight some of the positives that could be considered in a post-pandemic setting. Prostate Cancer UK have noted that the policy change during the pandemic that granted special access to certain COVID-friendly novel hormone therapies for patients was very warmly welcomed by the community. It is something that's been wanted for some time and has not only kept patients safe at home during the pandemic, but it also improved their care experiences as less time was spent in hospital. This, along with increased interaction between patients and clinicians using technology, made for higher levels of patient satisfaction and experience. Greater access to diagnosis, treatment, and the increased use of technology is something I look forward to seeing in my own constituency at the London Cancer Hub, which is an exceptionally exciting project in the London Borough of Sutton. And the Minister will know, as a former employee, the Royal Marsden very, very well, so I'm not going to go over ground that she, of course, knows herself as a former cancer nurse, who I believe is still practising. Yes, she's nodding her head. But the Royal Marsden and the Institute of Cancer Research, or the ICR, already form one of the leading cancer research and treatment centres in the world, and the development plans for the London Cancer Hub double the capacity for cancer research on the site, putting it second only to the United States, and will be a real game changer in cancer research, taking that to the next level. So there is a prime opportunity to ensure that the reduction in prostate cancer diagnosis remains only a temporary blip in the overall effort to achieve early diagnosis for all of those with the condition. But a key part of this must also include the cancer workforce. The government has already invested money into addressing the cancer backlog, but the workforce issue must also be addressed. Patients with prostate cancer and their families already go through one of the most difficult things in life to navigate and are desperate to have more clinical nurse specialists who provide holistic, patient-centred care with the empathy needed in these very dark times. Access to clinical nurse specialists for prostate cancer patients means they're far more likely to be positive about their care and the treatments, as well as receive more individualistic treatment plans. And one suggestion to be considered for post-pandemic NHS is implementing non-medical, practitioner-led prostate cancer clinics. These would not only enhance the clinical pathways in prostate cancer, but would also relieve time burdens on oncologists and reduce the costs that can be cycled back into the system. With 1 in 4 consultant clinical oncologists reporting risk of burnout, and with COVID-19 exacerbating these issues over the past 2 years, investing in non-medical practitioners or increasing the number of clinical nurse specialists, or both, could be one of the solutions to addressing workforce concerns. So I do urge the government to work with NHS England and Health Education England, and indeed the devolved administrations, to ensure that professional working groups in the prostate cancer workforce are addressing the workforce backlogs, including clear training routes for healthcare professionals wishing to upskill. Ms McDonagh, I appreciate the strong interest in this debate, so I'm keen to conclude my remarks. But if the Minister can take this away, I hope that the need to find those 14,000 missing men in the prostate cancer treatment pathway and address workforce issues are indeed being looked at by the government. The pandemic has provided the NHS with a unique opportunity to rethink how we provide care not just to prostate cancer patients, but all cancer patients, with greater use of technology and the benefits of COVID-friendly treatments that patients have had access to throughout the pandemic. Finally, the one message that I hope that those watching will take away from this debate is please, please, please get yourself checked, especially if you're in one of those higher risk categories. Support for you and your family is fantastic and is out there, and you're never alone. So I urge everyone to book that vital first appointment, and I look forward to hearing the contributions from other members on this incredibly important issue.
The question is that this